Hello everyone, and here we are back again to part 2 of the frontal bone. So we have already discussed the squamous part of the frontal bone, its external surface and its internal surface, and now we are back to the orbital parts and the ethmoidal notch and the nasal notch of the frontal bone. So first of all, the orbital part, which is better visualized in this picture from behind, and you can make out the orbital plates of the frontal bone, and these orbital plates form the roof of the orbit, and the articulations of this orbital plate, it has a medial border over here, and these medial borders form the margins of the ethmoidal notch. Then you have the posterior border over here, and this posterior border articulates with the lesser wing of the sphenoid, and further laterally over here you have a region in the posterior border which is actually placed between the greater and lesser wings of the sphenoid, and lateral most you have a triangular region which articulates with a corresponding triangular region in the greater wing of the sphenoid. So lesser wing of the sphenoid, junction between greater and lesser wings, and greater wing of the sphenoid. Now you have an inferior surface or the lower or orbital surface, and you have a superior surface that we cannot see from here, the upper or the cerebral surface. Now on the upper or cerebral surface you have impressions of the lower surface of the frontal lobe, which is also called its orbital surface. You have impressions of the gyri that are present on the orbital surface of the frontal lobe of the cerebral hemispheres, and here what you can see is actually the lower or orbital surface which forms the roof of the orbit. Here on the lateral part, somewhere here, you have a depression for the lacrimal gland, that is the orbital part of the lacrimal gland. The lacrimal gland, as you know, it has an orbital part, it has a palpebral part, and both are winding around the levator palpebri superioris. So the lacrimal part of the orbital part of the lacrimal gland is lodged here, and medially somewhere here you have a depression for the fibrocartilaginous pulley of the superior oblique muscle. Not only that, at this orbital margin you have the attachment of the orbital septum. And now from the orbital plate, let us come to the nasal notch and the nasal spine. Now this nasal notch, from front back towards the back, it articulates with the nasal bone, with the frontal process of maxilla, and with the lacrimal bone. Again, from before backwards, it articulates with the nasal bone, with the frontal process of the maxilla, and the lacrimal bone. And this meeting point between the internasal suture and the frontonasal suture is called the nasium. And this projecting thing over here, this is the nasal spine. It articulates with the nasal bones, that is, it is articulating with the crest formed by the two nasal bones which are attached to each other like the pages of a book, the two halves of a book. When they join together, it is like the nasal bones joining at the internasal suture, and behind these joining of the nasal bones you have a crest, that is the nasal crest, and to this nasal crest is attached the nasal spine. That means this nasal spine is also forming part of the nasal septum, and because it's forming part of the nasal septum, this nasal spine is articulating posteriorly with the perpendicular plate of the ethmoid, which we can see here. Here you can see the nasal spine posteriorly articulating with the perpendicular plate of the ethmoid, and anteriorly it is articulating with the crest formed by the nasal bone. So nasal spine with the nasal crest, perpendicular plate of the ethmoid forming part of the nasal septum, and on either side of the nasal septum it is forming a part of the roof of the nose. So that is for the nasal spine. Now this nasal spine then supports the nasal bridge. The sides of the spine form the roof of the nasal cavity, and it also forms the nasal septum. Now we come to this large U-shaped ethmoidal notch. Now this ethmoidal notch, the margins of this ethmoidal notch articulate with the labyrinth of the ethmoid. Now the upper surface of the labyrinth of the ethmoid also bears the cribriform plate of the ethmoid. Anyway, the margins of the labyrinth of the ethmoid articulate to the margins of the ethmoidal notch, and you can see these open ethmoidal air sinuses So the air sinuses in the margins of the labyrinth are actually completed, or their walls are filled up by these articulating margins of the ethmoidal notch of the frontal bone, and these margins complete the ethmoidal air cells. Now between the ethmoidal air cells you can make out these canals, the anterior ethmoidal canal and the posterior ethmoidal canal. These are actually grooves, and when these grooves are joined to the labyrinth of the ethmoid, they will form the anterior and posterior ethmoidal canals for the passage of the anterior and posterior ethmoidal vessels and nerves. And again, at the junction of the ethmoidal notch and the frontal crest, you have the foramen cecum. Not only that, anteriorly by the sides of the nasal spine, you can make out the openings of the frontal air sinus. So the lower parts of the frontal air sinuses are exposed over here, and their openings are beside the nasal spine. Now as far as ossification is concerned, there are two primary centers near each frontal tuber which appear at the 8th week of intrauterine life, and ossification, membranous in nature, extends from these frontal tubers to form the main part, the orbital part and the nasal parts. And between these two ossific centers, the metopic suture, it may usually be present up to 2 years from birth, and in rare cases remnants of the sutures may be present in adults. Apart from this, there are usually two secondary centers for the nasal spine which appear at about the 10th year. That is all for the frontal bone today. Thank you.